And I ask that if you have any questions on Facebook, and I will get to them at the end of the presentation. Before I begin, I want to start with this disclaimer. The following content is for informational purposes only. It is not to be interpreted as legal advice, and the information contained is not necessarily applicable to your specific case or situation. If you have any questions about your specific case or situation, please give our office a call and we'll be happy to assist you. So I'm going to start with the federal statute. And the federal statute states that the resident has a right to receive visitors of their choosing at the time of their choosing, subject to the resident's right to deny visitation when applicable, and in a manner that does not impose the rights of another resident.
Oh, am I late?
It's important that we remember that this is the resident's home. And just because they're living in a facility, it does not take away their right to receive visitors. As we know, COVID-19 has had a huge impact on visitation. During a public health emergency, the state and federal government are allowed to restrict visitation in order to better protect the most vulnerable of the population. However, while visitation may be limited at this time, nursing homes are still responsible for ensuring that residents and family communication is ongoing and supported by virtual visits whenever possible. And for virtual visits, this includes both video calls and window visits. So now I'm going to discuss the current guidelines for visitation put out by Department of Health. And the requirements are that nursing homes are able to resume outdoor and limited indoor visitation when the nursing home has had no new onset of COVID-19 cases for 14 days. And this includes both residents and staff. The facility also has to be in full compliance with federal and state COVID-19 reporting requirements, have completed and submitted a New York State forward safety plan, have no staffing shortages, and have access to adequate testing. Right now, the Department of Health strictly prohibits in-room visitation except for residents who are bedbound, end-of-life visits, or parents visiting a pediatric resident. And it's important to note that visitors must present a negative COVID test within the past 7 days. And this is 7 days from when you get your results, not from when you take the test. End-of-life and compassionate care visits do not need to present a negative COVID test. And below, I have included the link to the full guidance for visitation for nursing homes by Department of Health. Just over a month ago, Governor Cuomo initiated the Cluster Action Initiative, and this created red, orange, and yellow zones in New York State. For yellow zones, the visitation guidance is the same as the ones that I just mentioned, but they are slightly changed for red and orange zones. So for red zones, all visitation is suspended in residential congregate facilities. So this is both nursing homes and adult care facilities. However, the exceptions include compassionate care visits, visits that are medically or clinically necessary, a visitor accompanying a minor at a pediatric facility, and necessary legal representatives. For orange zones, visitation is suspended if a staff member or resident in the facility tests positive for COVID-19 in the last 14 days. And the same exceptions for the red zone apply for the orange zone as well. And below, I have included a link to find out if a nursing home or adult care facility is located in a red or orange zone. And what that link will do is when you go to the website, you will just put in the address of the facility and it will tell you what zone the facility is located in. Compassionate care visits. So compassionate care visits are no longer exclusive to end of life or hospice situations. If a resident is exhibiting signs of depression, anxiety, weight loss, and/or cognitive decline, this could fall under a compassionate care visit. Compassionate care visits are not ongoing, but they can potentially help a resident's quality of life improve. And visitors do not need to present a negative COVID test for a compassionate care visit. Facilities will evaluate the need for a compassionate care visit on a case-by-case basis. So the facility will look at your particular situation and based on current Department of Health and CDC guidelines, we'll see if your situation will qualify for a compassionate care visit. The Centers for Medicare and Medicaid Services, known as CMS, are the federal guidelines for visitation. And they state that visitation should be person-centered and consider the residents' physical, mental, and psychosocial well-being and support their quality of life. Facilities must follow core principles and best practices that reduce the risk of COVID-19 transmission, including screening all who enter the facility for signs and symptoms of COVID-19, denial of entry of those with signs or symptoms, hand hygiene practices, face covering or mask, and social distancing. CMS states that facilities should accommodate and support indoor visitation, including visits for reasons beyond compassionate care situations. Visitation will be allowed as long as there has been no new onset of COVID-19 cases in the last 14 days, and the facility is not currently conducting outbreak testing. And outbreak testing occurs when a new case arises in the facility. If a facility has had no COVID cases in the last 14 days and the county positivity rate is lower medium, which is below 10%, the facility must facilitate in-person visitation consistent with the regulations, which can be done by applying the guidance. However, a facility may restrict visitation due to community spread, the facility's COVID status, and other factors. And I've included the full CMS guidance for visitation below. Adult care facilities and nursing homes have similar requirements for visitation, but there are some differences. So I'm going to highlight the differences for adult care facilities now. Adult care facilities may resume visitation as long as there has been no new onset of COVID-19 cases for the past 14 days. And again, this includes both residents and staff. The facility is in full compliance with federal and state COVID-19 reporting requirements. They've undergone an infection control survey on and before May 1st by Department of Health and have been found to be in compliance, have completed and submitted a New York State forward safety plan, have no staffing shortages, and have access to adequate testing. And the important difference to note is that for adult care facilities, visitors are not required to present a negative COVID test as a condition for visitation. And I've included the full guidance for visitation for adult care facilities on this slide below. Just in time for the holidays, the New York State Department of Health released a guidance at the end of November for temporary leave requirements. And that states that facilities must continue to ensure that all visitors adhere to all visitation guidelines and facility policies and strictly adhere to infection prevention and control measures such as social distancing and face covering requirements. Department of Health and CMS recommend against residents leaving nursing homes for home or family visitation or other social outings during the holiday season. This is because data has shown that small family gatherings contribute to the spread of COVID-19. Nursing home and adult care facility staff should educate the families who are contemplating taking a resident out of the facility for the holidays, as well as the residents about the risk of leaving the facility and the alternative virtual communication options available. Even though Department of Health and CMS recommend against residents leaving the facility for the holidays, residents still have the right to leave the facility for a temporary leave of absence to visit relatives or friends. However, as stated, the following must occur. So a resident who leaves the facility must quarantine or minimize contact to the extent safely possible prior to the return to the facility. They must test negative immediately within 24 hours prior to the return to the facility, be quarantined on transmission-based precautions upon return to the facility for 14 days, be tested at least 3 times during the 14-day quarantine period at the facility, including on the first day upon return and the last day that a resident must be quarantined. And if the resident decides to leave the facility must require the leaving resident and a family or friend attest in writing that they are aware of the risk involved with taking the resident out of the facility, will follow masking, social distancing, and hand hygiene practices pursuant to CDC and Department of Health directives, will notify the facility if the resident becomes ill within 1 week of leaving the facility, will notify the facility if anyone with whom the resident socialized with tests positive for COVID-19 or influenza or exhibits symptoms of COVID-19 and influenza within 14 days of the resident's return to the facility, will communicate with the facility about a return date for the resident to the facility in accordance with the facility's policy, and will quarantine or minimize contact or assist the resident to do so to the extent safely possible prior to the return to a nursing home. Facilities also must develop a plan for the return of residents who leave for home or family visits or social outings. They must also notify families taking residents out of the facility that residents will not be permitted to return until they present a negative COVID-19 test within the preceding 24 hours. And lastly, screen and increase monitoring for signs and symptoms of illness upon residents' return. So what this all means is that if a resident wants to leave the facility for the holidays and visit family, protective measures have to be put in place, and the facility has to educate the resident and the family of those measures. The resident also has to know when and where they will be tested. And most importantly, if they test positive, they will not be allowed back in the facility until they test negative. So the family has to make sure that they will be able to take care of the resident until they test negative and will be allowed back into the facility. And I have included the full link of the holiday temporary leave guidance on this slide. So now I want to discuss different advocacy tips for visitation. First, this is advocacy tips for when in-person visitation is suspended. So if in-person visitation is suspended, all facilities must offer virtual visits and accommodate window visits. And you should contact the activities department or social services with when you could schedule a time for a virtual or window visit. Family members should be receiving regular communication from their prospective families regarding test cases and visitation changes. Families should also be checking the facility's website daily because changes can occur very quickly. And when seeking a visit, check the facility's website. Some facilities offer family members the option to sign up for an in-person visit on their website. If you're unsure about this, again, you should contact the Social Services or Activities Department. Now for advocating for a compassionate care visit. Like I mentioned earlier, if you've noticed that the resident has lost weight or they're showing signs of psychological decline, or if virtual visitation is not a suitable alternative to in-person visitation, they could qualify for a compassionate care visit. You can also request a care plan meeting if you've noticed any of these signs or symptoms. A care plan meeting is required minimally quarterly, but if you notice something like a loss of weight or psychological decline, like depression or anxiety, you should request another care plan meeting. And I've included the link to a guide on our website, Nursing Home Resident Rights and Tips. And this goes into more detail about requesting a care plan meeting. It's also a great resource for residents as it goes into more detail about resident rights. And our staff paralegal, Liam McMahon, presented on this earlier this week, and his presentation is on our Facebook page. And it will also be available on our YouTube channel and our webpage in the near future. Here are some more tips, some more advocacy tips and questions that you can ask the facility. You can ask them what their COVID visitation policy is and if you can have a copy. You can ask who you should contact to arrange a visit for both virtual or an in-person visit. Ask them where you can get tested and when you should get tested, because you want to make sure that when you get tested, that when you get your result, that you're able to visit within that 7-day time frame. Also ask if the facility will offer you a test. And lastly, what activities are being offered to the residents during this time? It's important that with visitation, in-person visitation being limited, that activities are still being offered to the residents to help keep up morale. Another advocacy tip is emailing, calling, or writing your local representative and sharing your story. This fall, there were 2 companion personal care visitor bills that were introduced. The bill introduced in the Senate was sponsored by Senator May, and the bill introduced in the Assembly was sponsored by Assemblyman Bronson. And these bills would allow for a single individual to become an essential support person for a resident and go into the facility, and they would follow the same infection control protocols as the staff who enter the facility every day. And it's important that if this is a bill that you would like to see passed in early 2021, that you contact your local senator and assembly members and urge them to support this bill. And I've also included the link to where you can find your local senator and your local assembly member. Some more advocacy tips. You can email, call, or write Governor Cuomo, and I've included the link to the contact form online with how you can go about emailing, calling, or writing him. You can also call your local news agency and share your story and your concerns. It's important for people to hear how COVID-19 has impacted visitation and how it's impacted both residents and their families. You can also file a complaint with the New York State Department of Health. The New York State Department of Health investigates complaints and incidences in nursing homes, and they have the ability to issue citations and fines. And you can file a complaint with them in 2 ways. You can call the hotline number that I've listed, or you can fill out the complaint form on the website that I've listed as well. You can also file a complaint with the Attorney General Medicaid Fraud Control Unit. So this unit investigates and prosecutes abuse and neglect of residents in nursing homes. And you can follow a complaint with them as well in 2 different ways, by calling the number listed or by using the contact form online. You can also reach out to your local ombudsman. So the ombudsman program is a federally mandated program, which is in every state, and their job is to resolve quality of care complaints and long-term care facilities. So our local ombudsman is Region 15 for Western New York. And if you have any complaints that you would like to address with them, you can call the number listed below. And lastly, you can contact us. We have been advocating for increased visitation and communication and helping residents and their families do this. So if you have any questions or concerns, please contact our office so that we can assist you. And lastly, on the slide, I have included another guide that's on our website, and it's where to turn when there's a nursing home concern. And it goes into further detail about how to file a complaint with the New York State Department of Health, the Medicaid Fraud and Control Unit, and also about contacting your local ombudsman. So at this time, I'm going to open it up for questions.
So if anyone has questions on the Zoom call, you can type them in the chat, or I think you can ask to unmute yourself. Okay, so we have a question, Bria. I don't know if you can see it. Have you learned anything about how vaccinations of nursing home residents may impact visitation policies?
I have not, but I'm sure when we get more information on that, we most likely will post a blog about it, but then we can also reach out as well if anyone has any specific concerns about that once the vaccination is administered.
Yeah, I would say that we do regular updates, and I think something like that, we would probably send out a mass email as well as the blog. So you can kind of keep your ears and eyes open for information from us.
Question. You just read a batch of things to us. Is this in a brochure that you can send us or anything?
Say that again?
You just went over a batch of things with us, a presentation. Is there a brochure or anything that you have that you can send to us if we would like?
For all the information that was
Presented to us.
presented?
Is it in a brochure or anywhere, any kind of booklet that?
So it's not in a brochure. Shana, I don't know if there's a way that we'd be able to send out the presentation itself, like in a PDF or something like that.
Okay.
Sure. If you want to send me in the chat, you could do a private chat with your email address, or you could give us a mailing address, or if you want to just call our agency and request it that way, we can send it out.
Okay, thank you.
You're welcome. Let's see. We don't have anything on Facebook at the moment, Bria.
Okay.
Does anyone else on the Zoom call have any questions for Bria?
Yes, can you hear me?
Yep.
Yes.
My mother's nursing home has stated that the Department of Health is requiring them to not allow visitation while the county is in an orange zone, but your presentation seems to suggest otherwise. Have I misunderstood?
So it states that, so in an orange zone, so visitation would be suspended if someone in the facility, a resident or staff, tested positive in the last 14 days.
If that has not happened, however,
If that has not happened, then they should facilitate visitation.
okay, so they're not, because you also had said that facilities had a little bit of discretion but it sounded like that was in cases during times in which the community spread was greater than 10%.
Right. Oh, so that was for the federal guidelines.
Oh, that's federal. Okay.
So for New York State Department of Health, if the facility is COVID-free for 14 days, both residents and staff, they should be facilitating visitation.
Okay, so I should be able to go to the nursing home and say what you're doing is not a Department of Health requirement and I should be allowed visitation.
Right.
Okay, thank you for clarifying.
No problem.
And if there are questions, you know, that you want to talk through in more detail, feel free to give us a call. You can talk with Bria or Liam or anyone else in the unit that can work through some things with you. You can also call our free senior legal advice helpline. And I will put that number up on the screen, on the chat here. Let's see. There you go. Okay, does anyone else have questions for Bria? Okay, I think we're ready to wrap up then. Bria, unless you had anything else?
Okay. I just wanted to say again, like if anyone has any more questions or concerns, or if they want to go over their case in more detail, please feel free to give our office a call and we will be able to help you with that. And thank you everyone for joining today.
All right, thank you.